ECE Cardiovascular System Guidebook, Early Clinical Exposure Cardiovascular SYSTEM History and Physical Examination Skills. Cardiovascular System. ECE Cardiovascular System Guidebook. Early Clinical Exposure. Cardiovascular SYSTEM. History and Physical Examination Skills. Synopsis. The cardiovascular system block is the first system block the Year 1 students are exposed to. In this block, the student will learn how to take a specific system-based history of symptoms and examine the cardiovascular system, as well as perform a general examination related to the cardiovascular system, interpret the symptoms and signs, and arrive at a provisional diagnosis. They will also learn to record their findings in a case report format in their logbooks. Introduction. The cardiovascular system comprises the heart and the vascular system. It is of great importance because it is affected by several very common and potentially serious diseases, in particular coronary artery disease, which causes angina, myocardial infarct, and congestive cardiac failure. The history-taking skills session is now focused to the cardiovascular system, and the physical examination skills session involve the measurement of blood pressure, pulse rate, jugular venous pressure, and examination of the heart. General objectives. By the end of the block, you should have acquired the skills of history taking in a patient presenting with a cardiovascular disorder and developed a proper examination technique of the cardiovascular system. A focused history taking. By the end of the block, you should have acquired the knowledge, skills, and attitude to demonstrate your ability to 1. Utilize a systematic and holistic IPP/ROACH to history taking. 2. Elicit and record an appropriate clinical history from patients presenting with a cardiovascular problem. 3. Obtain appropriate background information. 4. Apply critical reasoning skills to identify differential diagnosis. 5. Identify the risk factors for coronary heart diseases. 6. List the various causes of chest pain. 7. Explain the pathophysiology of coronary heart disease. 8. Communicate effectively with the patient, relatives, and others by being able to A. Empathize via active listening skills and recognition of the nuances of nonverbal communication. B. Build rapport and trust with the patient. C. Explain to the patient of confidentiality of information. D. Obtain appropriate valid consent, defining associated underpinning medical/legal and ethical principles, and ECE Year 1 Semester 2. Focused physical examination. By the end of the block, you should have acquired the knowledge, skills, and attitude to demonstrate your ability to 9. Explain to the patient of confidentiality of information. 10. Gain appropriate valid consent, defining associated underpinning medical/legal and ethical principles. 11. Determine the peripheral pulses, measure the rate, and describe characteristics of the pulses. 12. Measure the blood pressure. 13. Observe for race in the jugular venous pressure. 14. Conduct a complete cardiovascular system examination in a proper and acceptable manner. 15. Describe the component of cardiovascular system examination. 16. Explain and share with the patient, using simple language, the findings of the examination. Early clinical exposure cardiovascular system. Guide to history taking. A. Early clinical exposure. Cardiovascular SYSTEM. Guide to physical examination skills. Examination of the cardiovascular system. A methodical approach is recommended when performing an examination of the cardiovascular system. A complete examination of the cardiovascular system includes 1. General observation. 2. Examination of pulses. 3. Blood pressure measurement. 4. Examination of the face, mouth and neck, a carotid artery and JVP. 5. Examination of the precordium. A. Inspection. B. Palpation of apex beat, thrills and heaves. C. Percussion. D. Auscultation I. Heart sounds 2. Extra heart sounds Roman 3. Additional sounds, for example, snaps, clicks, or prosthetic heart sounds IV. Murmurs V rubs. Scenario: patient presented with chest pain. Setting: outpatient clinic. Patient is already lying on the examination couch. Introduction: patient identification and consent. 1. Introduce yourself with a friendly greeting, giving your name and status. For example, hello, I'm Nabil, a first-year medical student. 2. Confirm the patient's identity. Most patients in hospital have an identification bracelet, which includes their name and hospital identification number, as well as other important information. It is good practice to verbally check with the patient their correct details, and also their identification bracelet. 3. Explain to patient what you are about to do and why. 4. Inform the patient of confidentiality. Patient information is generally held under legal and ethical obligations of confidentiality. Information provided in confidence should not be used or disclosed in a manner that might identify a patient/client without his or her consent. 5. Get verbal consent from the patient. Performed not. Competently but not fully performed or competent incompetent 210. L. Examination of the precordium. L1 inspection. 1. Inspect the precordium from the right side of the patient and from the end of the bed. Look for a chest deformity. B. Abnormal pulsations. C. Implanted pacemaker. D. Scars. 2. Inspect the apex area. With women, you will usually need to lift the left breast to see this area properly. Ask permission first. Do you mind if I lift up your breast? If granted, proceed to lift the breast with your left hand and inspect. Look for A. Cardiac pulsation. B. Left thoracotomy scar. L2 palpation. 1. Palpate the cardiac impulse. A. If you have seen a pulsation during inspection, palpate for this first with the index, middle, ring, and little fingers of your right hand. B. If you do not see anything on inspection, palpate around the 5 intercostal space in the midclavicular line. 2. Find the apex beat and apical frills. A. Once you have found an apical pulsation, feel a little further down and out to see if it is still palpable. B. Continue until it is no longer palpable. C. Go back to the furthest point down and out which you felt the cardiac impulse. This is the apex beat. D. Decide whether an apical frill is present or not. 3. Decide on the character of the cardiac impulse. A. While palpating, decide if the character is normal or abnormal. B. If abnormal, I. Is it tapping, heaving, or thrusting? 4. Ascertain apex beat position. A. Decide how lateral apex beat is I. Midclavicular line, normal. Performed competently. Performed, but not fully. Competent 1. Not performed or incompetent 0. Figure 1. CVS examination, positioning the patient. C. Elsvier, Talley, and O'Connor, clinical examination 5E. Figure 3. Feeling for collapsing pulse a C. Churchill Livingstone, McLeod's clinical examination 12E. Figure 5. Palpation of the carotid pulse a C. Churchill Livingstone, McLeod's clinical examination 12E. ECE Cardiovascular System Guidebook. Figure 2. Arterial waveforms C. Elsvier, Kumar, and Clark, clinical medicine 6E. Figure 4. Checking for radiofemoral delay a C. Churchill Livingstone, McLeod's clinical examination 12E. Figure 6. Assessment of JVP C. Elsvier, Talley, and O'Connor, clinical examination 5E. Figure 7. Feeling for the apex beat a C. Elsvier, Talley, and O'Connor, clinical examination 5E. Figure 11. Use the bell to listen to mitral stenosis with the patient in left lateral position. C. Churchill Livingstone, McLeod's clinical examination 12E. ECE Cardiovascular System Guidebook. Figure 10, the areas best for auscultation, ECE, Churchill-Livingstone, McLeod's Clinical Examination 12E. Figure 12, use the diaphragm with the patient leaning forward to listen to aortic regurgitation, C, Churchill-Livingstone, McLeod's Clinical Examination 12E. Early clinical exposure, Cardiovascular SYSTEM Guide to Procedural/Practical Skills. Performing a 12-lead electrocardiography, ECG, and electrocardiography interpretations. Introduction. In the human body, the heart is responsible for pumping oxygen-carrying blood to the entire body. To do this, it emits a small electrical charge that will cause the muscles around the heart to contract in a sequential way such that the blood is pumped throughout the body. If there are deficiencies or abnormalities, the individual may be susceptible to serious health issues, including cardiac arrest. Caregivers in hospitals worldwide must be able to monitor these electrical charges and, in doing so, be able to predict complications before they cause serious harm. To do this, a device called an electrocardiogram, ECG/EKG, is used. An ECG involves placing small pads in a triangular fashion on the patient's chest, and these pads are actually small leads connected back to a monitoring system that will measure the potential voltage differences around the heart. The wave of depolarization that spreads through the heart during each cardiac cycle has vector properties defined by its direction and magnitude. The net direction of the wave changes continuously during each cardiac cycle, and the ECG deflections change accordingly, being positive as the wave approaches the recording electrode and negative as it moves away. The standard 12-lead ECG uses recording made from 6 precordial electrodes and 6 different recordings from the limb electrodes, left arm, right arm, and left leg. The right electrode is used as a reference. 6 of the leads are obtained by recording voltages from the limbs III, AVR, AVL, and AVF, whereas the other 6 leads record potentials between points on the chest surface and an average of the 3 limbs, RA, LA, LL. These are designated 5 sub 1 - 5 sub 6 aim to select activity from right ventricle left parenthesis, 5 sub 1 - 5 sub 2 right parenthesis intraventricular septum left parenthesis, 5 sub 3 - 5 sub 4 right parenthesis on left ventricle left parenthesis, 5 sub 5 - 5 sub 6 right parenthesis. C. Elsvier, Kumar, and Clark, Clinical Medic, V sub 1. ECE Year 1 Semester 2. Diagram A and B show the directions from which the 12 leads look at the heart. The shape of the normal ECG waveform, its deflections and explanations as in Table 2. P wave N 0.12s, QRS complex N 0.10s. T wave PR interval N equals 0.12 to 0.22s. QT interval N equals 0.44 males and 0.46 females. ST segment. Figure 1. ECE, Churchill-Livingstone, McLeod's Clinical Examination 12E. Low amplitude slow deflection caused by atrial depolarization. Reflects ventricular activation or depolarization and is sharper and larger in amplitude than the P wave Q wave, initial downward deflection. R wave, initial upward deflection. S wave, last part of ventricular activation. Slow and low amplitude deflection that results from ventricular repolarization length of the time from the start of P wave to the start of QRS complex. Time taken for the activation to pass from SA node through the atrium, AV node, and his Purkinje system to the ventricle. Start of the QRS complex to the end of T wave. Time taken to depolarize and repolarize the ventricular myocardium. Period between the end of QRS complex and the start of T wave. All heart cells are depolarized by this phase of the ECG, that is, the ST segment represents ventricular repolarization. Figure 2. ECE, Churchill-Livingstone, McLeod's Clinical Examination 12E. General objectives. In combination with supervised accredited practice, by the end of the block, you should have acquired the knowledge, skills, and attitude to set up a 12-lead electrocardiography, ECG, and systematically interpret basic electrocardiogram. Specific objectives. By the end of the block, you should have acquired the knowledge, skills, and attitude to demonstrate your ability to A. Prepare the patient for a 12-lead electrocardiography. B. Prepare the equipment and materials required for performing a 12-lead electrocardiography. C. Explain to the patient/family on the technique and purpose of performing an electrocardiography. D. Obtain appropriate valid consent, defining associated underpinning medical/legal and ethical principles. E. Explain to the patient of confidentiality of information. F. Systematically interpret a basic electrocardiogram. Equipments and materials. A. ECG monitor. B. ECG electrodes. C. ECG leads. D. ECG jelly. E. Razor. F. Cotton swabs soaked in alcohol. G. Cotton balls. Early Clinical Exposure Cardiovascular SYSTEM Guide to Procedural/Practical Skills. Performing a 12-lead electrocardiography, ECG, and electrocardiography interpretations. A. Performing an ECG recording. ECE Cardiovascular System Guidebook, not performed or incompetent 0. B. Electrocardiography, ECG interpretation. Adapted from ECG, a methodical approach. http://www.patient.co.uk/doctor/eca methodical approach HTM. Figure 3 electrode placements.